Hi, everybody. Thanks to the World Water Week for enabling this panel discussion, and thanks to all of you for joining this session on evaluation of water interventions. Sorry, my camera is not great, so you're not able to see me properly. But yeah, these are tech difficulties. This discussion is being convened by International Initiative for Impact Evaluation. We are more popularly known as SIWI, and you might have heard of us. We are the global leaders in the generation as well as of use of evidence for decision making. We provide guidance and support to produce, synthesize, as well as quality assured evidence on what works for whom, how, why, and what cost. As for me, I'm Monica Jain. I'm the lead evaluation specialist at 3IE. I'm an economist by training, and at 3IE, I have been the technical lead of a very big evidence program, which funded multiple impact evaluations around the world in sectors such as infrastructure and environment, where the high quality of evidence on which interventions work is scarce. So this program also included the two studies that we will be discussing today. And we have a very knowledgeable and experienced panel with us today. So first of all, I would want to introduce Manzoor Dar. So Dr. Dar is a research and development professional with more than 15 years of global research and development experience in technology evaluation, impact assessment, seed and extension systems, and scaling. He had a long stint of about a decade at International Rice Research Institute, and currently he's the Vice President of AFC India. He is a PhD and postgraduate in agriculture from Aligarh Muslim University, and subsequently he has completed his MBA in project management from KSO University, Manzoor. Our second panelist is Anna Tompsett. She is an assistant professor of economics at Stockholm University. She originally trained as a civil and environmental engineer before earning a doctorate in sustainable development at the Earth Institute at Columbia University in New York. She has been working on randomized experiments related to safe drinking water in Bangladesh for more than a decade, in close collaboration with NGO Forum for Public Health, a long-established Bangladeshi NGO working primarily in water supply and sanitation. So that is the introduction to the panel. So the plan that we have for this panel discussion is that in the first 30 minutes, we will have the panelists discuss among ourselves the key questions regarding evaluations. And then we will open the floor for audience questions. So if you have any question, which you want to address to any of the panelists, please put your question on the Q&A. So let's just start a discussion now. So the two studies that we will be discussing today are both very interesting. They're both from Bangladesh, and they both focus on providing sustainable and safe water to the rural areas. While the one which Anna is going to be talking about, her study, it's focused on drinking water. And the other, which Manzoor is going to be talking about, is focused on water for irrigation for farmers. So let me start this discussion actually by asking Anna and Manzoor to briefly describe the interventions that they have recently evaluated in Bangladesh. So Manzoor, would you like to start and tell us about the intervention that you have evaluated recently? So Manzoor, you are on mute.
Okay, thank you, Monica, and welcome everybody. Yeah, definitely, what we wanted to evaluate in Bangladesh was the technology, which is generally called AWD. AWD is a, alternate wetting and drying system. It's a small perforated plastic pipe which farmers actually use to save water. It is, if I have a pipe here, if somebody is interested to see, it's just a very, very simple PVC pipe which has, holes, and it is put inside the soil so that farmers can actually see when they actually need to, use the water. So we wanted to actually test this AWD technology against, farm incomes and how much water farmers can save. And the main evaluation questions involved were like, what is the average impact of this technology on water savings? And, what is the impact of this technology on other input use, whether, it has any impact of other herbicides, because people generally believe that if there is less water used in rice is, by the way, the crop which is which consumes most of the water. So if there is less use of water, so herbicide use is more because weeds are more. So we wanted to also see the impact of this pipe if there is any increase or decrease in that use of those inputs. Like, apart from that, what was also important for us to understand is impact on its overall profitability from the plots where these plots could be used, and whether it has any external benefits by saving water, because water is in Bangladesh is mostly used from tube wells, which are either driven by pumps, which are used by fuel, like diesel is used, or maybe electricity. And in both the cases, whether it's electricity or it is fuel, there's a lot of carbon emissions and greenhouse gases also, which are produced by excessive use of water. So we wanted to see the total impact of this water reducing technology on the farmers' income, whether they save money by using less water, and if there is any impact on the external benefits like methane emissions from rice, or and then we also wanted to see how farmers respond to it in terms of adopting it when we introduced in the first year. So that was the theory of change of the concept, and this technology is developed by International Rice Research Institute, and it's been widely talked about, and we wanted to have a rigorous evaluation about its impact in the real world, which is farmers' field. Yeah.
Yeah, thanks a lot, Manzoor, and thanks a lot for showing that that AWD pipe. I think so. It's useful to see, that is like, this pipe, and that was being tested and seen, how does it impact both the profitability of farmers as well as, their input use, as well as this methane emissions. But we are talking about tube wells over here also, which supply water for farmers. And Anna, in your study also, there was a use of tube well. Can you elaborate what was your intervention?
Sure. So the context we're working in is, providing safe drinking water in rural villages in Bangladesh. And, in general, Bangladesh doesn't have a quantitative shortage of a scarcity of water, or that it does in some regions, but that in most people have quantitatively drinking water available. The problem is the drinking water quality. And so, surface water and very shallow tube wells are often have fecal contamination. And then if you go a little bit deeper, you hit a naturally occurring layer of arsenic contamination. And this is a totally naturally occurring problem. It's nothing that humans have done anything to cause, but it's there. And so a lot of these tube wells that access shallow groundwater are unfortunately coming up with arsenic contamination. So this has historically been a huge problem. I think, by 2015, when we started our project, there were still sort of 80 million people in Bangladesh who didn't have access to who weren't using a source that was both arsenic and safe from fecal contamination. And so one of the simplest technologically, one of the simplest ways to address this is to just build a deeper tube well. So if you can go deep enough into the ground, you can basically hit a layer of groundwater that's isolated from those sources of arsenic and fecal contamination. And this is one of the most commonly attempted ways to provide safe sources of drinking water. Now, these are kind of expensive. I think in our study, they were costing us about $600 or $700 per well to install, because they go so deep. I mean, the top of the tube well is just an absolutely standard hand pump, but the cost is really in the drilling. So in our context, they cost about $600 or $700. So they're typically provided at a community level. But there's a lot of uncertainty about how effectively do these wells provide safe drinking water in the first place. Lots of open questions. One thing people have worried about a lot is that, by providing someone with a safe, arsenic-safe source that's more distant from the household, maybe people walk further, store water for longer, and we know that there are lots of ways that fecal contamination can enter drinking water that don't just come from the source. So without kind of an impact evaluation, it was unclear exactly how effective these were at providing safe drinking water. And so what we run is in communities in rural Bangladesh. So when I say a community, I mean a geographically contiguous group of between 50 and 250 households. And then we worked in 171 of these communities. We screened them based on arsenic contamination. So these are all communities that are facing an arsenic contamination problem at baseline. And then we randomly assigned a tubewell construction program to 129 out of those communities. So we had a control group of 42 communities who didn't receive any intervention from us, although we didn't stop them from receiving any other interventions from any other organization. We didn't prevent them from getting access to safe drinking water in any other way. I can speak more about it later, but just to have in mind, this is working with this experienced NGO who's been doing this for years. Best possible conditions in lots of ways. We used a consensus-based approach to decision-making that we've shown in past work improves outcomes relative to other ways you can take decisions. And we actually had, before we started, we did a baseline census of arsenic contamination in all the wells in the district. So we had a lot more information than many organizations do work with to start off with. And then based on that, we were able to evaluate, what's the water quality in our wells to begin with? How many people adopt the wells? How do they change their behavior and response? So how much do they increase the distance that they walk? How much do they increase the time they store water in the household? What's the change in arsenic and fecal contamination in the sources that they actually use? And then what's the change in arsenic and fecal contamination in samples of household drinking water? I don't know if I'm supposed to tell you results or not.
We'll come to that. So thanks a lot. I think that was very useful, description of the program. You've already touched that, you talked about control and treatment. So you've already kind of alluded to your evaluation design. It will be useful, Anna, if you can elaborate more on what evaluation design did you use and why did you use it? What was the rationale for using that design, which made you think that this is better than other designs that are out there?
So, I think historically, when we think about evaluating interventions to improve safe water, we often think about, looking at a place where things went particularly well, where an intervention was particularly successful, or we kind of just look within the group of places where we conducted an intervention. But the problem with that is, the places that we successfully carry out interventions may be different in lots of other ways from the places that those interventions never get carried out. So, they may differ in access to safe drinking water at baseline. They might have different kind of unique community or leadership characteristics that make interventions particularly successful. Or these kind of resourceful communities might have found ways to get access to safe drinking water through other ways over the course of the project. And so what we do by working in the context of a randomized experiment is we create two groups who are drawn from the same population. At baseline, we can show that they're statistically equivalent. There are no consistent statistically significant differences between those two populations at baseline. So this is kind of the best we can do in terms of saying, well, what would have happened if we didn't have, what would have happened in the absence of this intervention? And in our context, we found that the deep tubewell intervention was successful in reducing exposure to arsenic. It wasn't really successful in reducing exposure to fecal contamination for reasons that I can get further into. And the key thing that we learned that we would have gotten wrong if we hadn't had a control group is that arsenic contamination fell in our control group. Some people wonder if that's because we gave them lots of information and people switched wells, but really it just seems to be a kind of change in either arsenic contamination that we measured in tube wells, because the average fall we see in the control group is exactly the same as the fall that you see if you take exactly the same wells at baseline and follow up. They experience the same fall in contamination. And so because this is going on in this area, if we hadn't known what was happening in that control group, we would have basically overestimated the effects of our program by about 220%. So, in terms of thinking about how that would inform policy decisions, we would have been saying that the benefits of this program were more than twice as large as we really measured them to be. So that was kind of why this experimental design was critical for us in learning about the impacts of the intervention.
Yeah, thanks a lot, Anna. I think you have touched on this important point. Why do we need a counterfactual? And just the fact that you could have overestimated your effects by 220%, that's a huge number. And that's the reason you need rigorous impact evaluation designs. And that's what, 3I advocates for and supports. So Manzoor, I think we have talked about this very technical quantitative RCT part, but I also understand from you, your study, that you did a lot of qualitative work to both, which both informed your design of the evaluation as well as understand the working of the intervention, why certain aspects works and why they did not work. Can you elaborate on that? And also, how did you find, in what way do qualitative work really supports the impact evaluation work?
Yeah, I mean, as Anna says, we initially thought of doing a rigorous quantitative evaluation, which is RCT for evaluating this technology. Because the situation seemed to be very ideal for that. The technology, we wanted to do this survey, do this study in Bareen, the area of Bangladesh where most of the farmers actually come under those deep tube well or shallow medium deep tube well areas. And this pipe, was a counterfactual, a small treatment which we wanted to test against the control farmers. Exactly what Anna says, we wanted to see if, this pipe was not given to these farmers, what would have happened if in absence of those. So that was actual, plan to do this RCT about. But then, when we actually looked into the field and we saw how farmers actually are using water, what is the water arrangement between deep tube well owners and the farmers, and how those water dynamics takes place, what are the different water pricing regimes that are into the system, and then governance models around water was something which actually we couldn't have found out by just doing a quantitative survey. So coming to your question, I think it was very important for us, and it became actually very important for us to learn much more than what we could have learned from the quantitative data about what exactly happens at the community level, because that was very important. Our assumption or our in our theory of change was that farmers are using water by just paying to the owners about the water, the quantity of the water what they actually use, which actually didn't happen like that. So we found that there was a different arrangement where farmers actually pay to the owners on a contractual basis, on a seasonal basis, where we actually had to redraw our design, and that was all based on our qualitative discussions with the farmers, where we could understand, there was an intention to have some supplementary information about, so that we can validate what we get from the quantitative information. But at the same time, I think this qualitative information, what we got from the communities, was so important to understand for us the perspective of communities about, how do they see these technologies can help them, and what are the different barriers that can, deter them to adopt this technology because of the individual farmers do not use those cards. It was a different arrangements, and based on those insights, there are a lot of things which we could have got done by doing quantitative survey, like how this has happened, how that has happened, whether it is yes or no, but why that has happened was something which we couldn't have got from our quantitative information, which we actually got by doing these qualitative studies. I think it was very important for us and very timely for us to do those qualitative discussions with the farmers. And then we had to, if you look at our plan, we had to actually redesign our study, where we went or actually facilitated in some of the areas where we selected the farmers, facilitated the process of actually giving them those prepaid cards so that we can see the comparison between farmers who use this AW technology and who do not use it. Without that, I don't think we should have, we did not see any benefit by farmers in the first year when there was actually no difference between those farmers who used this pipe and who did not use pipes, because they did not have any such arrangement where they can only use that much of water which they actually need. So based on that, qualitative information became very important for us to redesign our plan of experiment and then come to the results which we have right now.
Thanks a lot, Manzoor. That was, I think, it is so important, to understand that, you in your first year, you realize that, you don't know why this is not working, right? And then you went to the community, and then you went to the, the community, and you talked to them, and you understood how these arrangements are working. So that gives you an insight of why it is not working. And then in the second and third phases of your study, you were able to use that information to both change your design, revise your design, modify your design, intervention design, as well as your evaluation design. And I think so. You've already touched on some of the challenges of doing the evaluations, right? To use all possible information, both quantitative and qualitative, to understand why things are happening the way they are, and then actually making changes to your interventions as well as your evaluations. It could be possible right in the middle, and which you have done, and successfully, right? But it could not have been easy. It is a big challenge.
It was, because we had an assumption that how you when it is introduced to you as a system working in the place, you really try to believe in that, and it actually did not work like that. So it didn't, it couldn't have worked for us without doing those discussions with the communities.
So Anna, I think we have heard about some of the challenges, that Manzoor study faced. What about the challenges that you faced in your evaluation and its implementation, for Safe Water?
Well, I think that one of the hardest things when we started the project was realizing that, that this baseline data about arsenic contamination really didn't exist. So, there was a blanket study in all wells in Bangladesh, but I think it was originally done in 2007. I think someone can probably correct me on that. And then there was an update in maybe 2014. The Department of Public Health and Engineering had they'd flagged certain villages as having arsenic contamination. But really, when we were working in a region of Bangladesh, which is not right in the epicenter of the problem, it's kind of further north. So arsenic contamination there is really scattered in these pockets. And so when, the intervention that we were working on is really targeted towards these communities that face the arsenic contamination problem. Because if you don't, then there are probably cheaper ways to get safe water than digging hundreds of feet into the ground. And so one of the things that was like time consuming and difficult for us was really detecting these places. And so we had to kind of put our own data collection procedure in place and screen all these communities at the beginning to really target the ones that had faced arsenic contamination as a problem. So that was something that was much more time consuming than we'd initially anticipated when we ran the study. And I don't know if it's a challenge really, but I mean, I think one of the great things about these studies is that you don't always learn what you expected to learn. And so, our original study, what we'd had in mind, and the intervention, there's a fairly widespread understanding in Bangladesh that these deep tube wells provide water that's both arsenic safe and safe from fecal contamination. And that's because you're drawing water from an aquifer that's really far under the ground. It's really, as long as the tube well platform and the tube well body and the pipe are all correctly constructed, the water source should be completely isolated from sources of fecal contamination. But actually what we saw was that, the wells that we built, these deep tube wells, they still had fairly high rates of fecal contamination when we tested the water that's coming from them. They were an improvement relative to the wells that are in those communities already, but it was really kind of like a 25% improvement relative to to those comparison wells in the same village. Whereas, you know, when we compare them in terms of arsenic, they're really almost wiping out arsenic contamination at source. And so this was surprising to us, surprising to many like Bangladeshi policymakers and stakeholders. In fact, some of them are still not convinced that this is true. It turns out that other people have found this. Actually, when we discuss this with lots of other engineers, some people have said to us, oh yeah, we found this in this study, but we wrote it off as a mistake. We thought it was a problem with that data collection. And in fact, we'd found it in an earlier study and we'd written it off as a mistake as well. But as we're, you know, this study has really kind of crystallized for us that maybe this is something that's happening more often. Some hydrogeologists you talk to will say, yes, of course, you know, they point to studies that should show this in other contexts, but this is really not something that's in the common wisdom in Bangladesh at the moment. And so, you know, having learned about this from this experience, you know, we're taking it forward and we're looking at how we can do a better job at examining this in the future, and whether there are any interventions we can put in place to address this, because it looks like what happens is that you get contamination introduced through the tubal mouth, and then you get a kind of biofilm accumulating inside the body of the tubal itself. And so the natural question is, you know, can you introduce a new cleaning regime that would get rid of that? So I know that ICDDRB, I forget what the acronym stands for, but the Institute for Research in Diarrheal Disease in Bangladesh. So they've shown that you can get rid of this by kind of covering it in like, you know, high alcohol content ethanol and burning it off. And that gets rid of the problem. But, you know, that doesn't seem like a great strategy to recommend that communities try and implement themselves. You know, nobody wants to sit around with 96% ethanol in their house. This is, you know, costly, dangerous. So the question is, you know, is there the next question that, you know, we're looking ahead to now is really, is there a cleaning regime that gets rid of this problem? And is it something that communities will be able to keep doing themselves over the future? And I should say, you know, all this work is in collaboration with the Bangladeshi NGO. My colleague Ahsan, I think he's on this call somewhere. I can't see him on the list, but you know, he's just started a PhD here in Sweden at KTH, and this is one of the things that he's going to be working on as he goes through his graduate studies. So I just wanted to plug that piece of our ongoing work.
Yeah, no, thanks, Anna. I agree. I think one thing is to realize is these studies are not standalone. There's a lot of work that goes before you actually start with one particular study, and then of course while you're during the study, and then after the study, it's not over, right? Because if you really want to make a policy difference, then that study answers some question, and then you have more questions, and then you keep, as a researcher, you know, you keep going back to them and you know, answering them, and then of course there are more questions. But I think what was interesting, and you've already alluded to, is that, you know, you had this very high fecal contamination, much more than what was expected, and stakeholders did not, you know, they were not convinced about it, you know, and because they felt, and the other studies have found it, and they felt that maybe there is a technical error. So I just wanted to understand, you have touched on stakeholder engagement, because that is, again, you know, if you want these findings to be used, the stakeholders, the important key stakeholders, you know, one, we have to communicate the findings and then to convince them. So by now, do you think they're convinced with your findings now that you have seen that there are other studies they've found it? And if they're still not convinced, what is it that you're doing, you know, to ensure that, you know, as we go and keep on doing the research in this area, you know, we have more credible findings which can actually convince the stakeholders?
So I think the body of opinion is changing slowly, and I mean we're very it's a very slow conversation. You know, we show up and have a conversation with policymakers. They ask us some questions. We go away, run an evaluation, come back in 3 years with the answer. You know, it's hard to. We're slow in produce. You know, it's time consuming and costly to run these kind of experiments. Which, you know, that's obviously one of the downsides of doing it. But so one of the things we've been interested in a long time in Bangladesh is, you know, not just about, you know, how do you build wells that are effective for the first year or the first year and a half or the first 2 years, but, you know, how long do these things last? I mean, again, these are really expensive interventions, and most people in Bangladesh are operating on the assumption that these wells are going to be in place for 10 years. That's the kind of number that they use in budget considerations. But, you know, we rarely have money available to track wells after the kind of end of a project. And so one of the things that we've been doing is in several generations of wells now over time in Bangladesh. So the first ones were built in 2008, I think, and we've been, tracking them up till today. Every couple of years we go back and check on what's going on. And so we're building into that study. We're now doing, before we had these relatively coarse tests of fecal contamination, which, we were doing a lot of water quality tests and we had a finite budget. So, we did the relatively cheap ones, but now we're going to be just focusing on the wells. We're working on doing better tests that give us more accurate estimates of not just is fecal contamination present, but to what extent is it present, and we're hoping that kind of data, when we can go back with that, it will help to kind of nudge the balance a little bit further in terms of being convinced on this. And I do think it's important because it's a huge problem, access to safe drinking water in Bangladesh. People are talking about investing millions of dollars in solving this problem. And if we're looking at interventions like deep tube wells, which our research suggests that they really can make a difference on arsenic contamination, but the cost of doing it is not cheap. So the best case scenario estimates that people had come up with before, using kind of models and assumptions about take up, the costs that we're coming up with are about like 2 to 4 times that estimate. So because we see lower rates of take up than people have assumed in the past it's going to happen in response to new wells. So, and if we're spending that much money and we're only solving the arsenic problem and we're not really making a dent on exposure to fecal contamination in drinking water, then, I think it's important to build that into that cost effectiveness discussion, because we're not solving the whole problem. And maybe there are other interventions that do better on both those fronts, can move arsenic contamination and fecal contamination at the same time. And maybe that really changes that cost effectiveness discussion.
Yeah, thanks a lot. I think, Anna, with the stakeholder engagement, we've also touched on the cost effectiveness aspect, though we won't have time to go in it, and I wish that we had. But I want to, because we are on stakeholder engagement also, and Manzoor's team, I think, did a very intensive stakeholder engagement. I wanted to bring him in because that's the last question, and then we'll open up the session to questions, audience questions. So Manzoor, I know you had very intensive engagement. One, how did that engagement make your study more policy relevant? And how did it help, facilitated, when you presented the findings, whether it are positive or negative or, uncertain, how did it make it more palatable to the stakeholders?
Yeah, Monica, as you are aware, we did organize, on annual basis, these workshops where we invited people from policy. We invited people, scientists who are working on this technology, and also the people who are into the extension, who are responsible for delivering such technologies. And, we kept them informing about the developments based on the results we used to get on, annual basis. And, it was a lot of awareness that was created among them. Although the AWD technology is not something that was new for them, they knew about, but I think the insights that came from the experiment were something very interesting for them, and it was very well received by them in terms of accepting those findings, and promising us to discuss follow up in coordination with other agencies. And in general, when we talked to them, it was a very, very good, atmosphere where policymakers would actually listen to what researchers have found. Particularly, when you talk about this technology, people always would say that this technology is capable of reducing 30% of water use, which is huge. And then, Bangladesh actually has already a policy of maybe having an uptake of 20% of AWD under, in the total rice area, which is a very challenging job. But I think what our study, provided them as an insight and an evidence was, this technology cannot work everywhere, and it has to, there has to be different arrangement for that. And then, looking at those aspects where people are supposed to be using those prepaid cards, we actually, have seen in our experiment that they are not, most of them are not either functional, or they are using different arrangements of using them. So unless these prepaid cards are used in a way where farmers pay for the water only for how much they actually use it, this AWD technology is not going to be adopted. And then, insights on how these, communities can actually help in bringing to, getting together and maybe negotiating with the with the owners, water tube well owners. And then there could be a policy from government itself where they can develop a pricing policy in different areas. And most importantly, if there is a drive to take this technology into various areas, the priority should be actually those areas where the prepaid card system actually is already existing. So these insights were very important for policymakers, although, the results that showed this technology is working well and is reducing this much of water use, and is reducing this much of methane gas emissions and all that, they're all well taken. But I think most importantly, what was important for the policymakers to take a message from this experiment was how actually these evidences can help them to deploy this technology so that adoption becomes easier. Otherwise, they could have tried years, which they have, but there's no significant adoption of these pipes by farmers, although they are profitable, just because of the the regime or pricing regimes that are happening in different. So overall, those intense workshops where a lot of discussions were done with all those stakeholders, it was very important for them. And I think they have very well received about these results and have taken notes of the findings. And I'm sure those findings and insights are going to be very useful when they are going to implement any policy in creating awareness or in delivering this technology to the farmers.
Yeah, thanks a lot, Manzoor. I think your statement that one technology does not work everywhere, and I think the important part, as you said, it's not the numbers, the impact estimates, but the fact that where does it work is the very important contribution of your study, besides, of course, providing all the impact estimates that are required. So thanks a lot. And I think with that, what I'll do is I'll look at the questions from the audience. And so I think I'll take the first question that was posted, because I think it has, it is valid for both the studies. So what, a colleague wants to understand, Sharing Shodan, I hope I'm pronouncing the name right, is how impacts on women's workload, health, well-being in different projects were measured. And if the impacts have been captured for different or all members of the household, taking account into intra-household dynamics. So I think this is valid for both Anna and Manzoor. Does any one of you want to take it first?
Maybe Anna. I was actually reading a different question.
Oh, okay.
I can take it.
Yeah, sure.
So when we measure, so we don't measure outcomes on health. Especially with respect to arsenic contamination, we didn't have. I think the kind of gold standard way to do this is to take kind of nail clippings or hair clippings and look for arsenic contamination in those. Look for those biomarkers. But we didn't have a budget to do that at the time when we started the study. And otherwise, arsenic is kind of a bioaccumulant. It builds up in your body over time. So even if you stop being exposed to arsenic as a consequence of our intervention, it's going to be kind of hard to detect those changes over the time frame that we're looking at in terms of actual health outcomes. We do collect data on children and diarrheal disease rates, but again, it's a little bit of a mystery in Bangladesh actually, but despite these like really high rates of exposure to fecal contamination in drinking water, self-reported incidence of diarrheal disease is relatively low. And it's a little bit of a puzzle that I don't think people have a super great answer to at the moment. But so we looked at some outcomes at the individual level. When we look at household drinking water, we really look at we ask households, give us a glass of water in the way that you would provide a glass of water from someone in the household. We're not sure people would really behave differently if we asked them to behave different, to imagine they were giving it to someone different in the household. I suspect that our estimates are most valid for people who spend more time at home, because the people who spend more time at home are the people who are going to be using these sources that we're focusing on most often. And that in this context in rural Bangladesh is most often the female members of the household and the children. And so we do look also at costs of using these wells in terms of who's going to collect water. In general, it is again women and children who are doing the majority of that, taking on the majority of that burden. People don't like walking far. So in our study, we see really that take-up rates peak at around for people who are exposed to arsenic contamination at baseline. Take-up rates peak at about, on average, households are collecting 40% of their water from our source if they live right on, basically on top of the source. So what does that mean? 40%, that means that it could mean that there are 10 households and 4 of them are using our source completely, or it could mean that some of them are using it 50-50. There's a lot of mixed use of different sources. And then that drops off really steeply, even when you get to 1-2 minutes walk away. So in terms of the burden that's being incurred by people of collecting water, it's more often in Bangladesh that people go and collect water frequently, numerous times in a day, rather than that they're walking far. So we know a little bit about these things. We don't always disaggregate all our outcomes in this respect, because we think about a lot of these problems as something that gets solved at a household level, and then we measure an outcome at the household level, and we really think about those inter-household dynamics that create that outcome, but we're not always able to see everything that's going on at the same time. And we do, more generally, we're super interested in, one of the ways in which we run these interventions is to lead these, our field staff lead these participatory processes, which, in principle, bring all the community members together to hash out where's the best place to look to build a well. And, even though the NGO requires female attendance at the meeting, we see this big gulf between the fact that, a large number of households are represented by a woman at the meeting, but the number of women who are kind of speaking out in the meeting, it's sort of on average fewer than one per woman speaking out at the meeting. And that's ignoring the fact that there are some meetings where women are super active. And so really more like the majority of meetings, there's no women speaking. And then there's, for some reason, in some communities, everything kind of comes together and you get this really active and amazing inclusive discussion. So, we think about all these things, but they're often things that happen along the way to the kind of household level outcome we look at. There may have been a longer answer than you were looking for, but.
That's fine. Manzoor, I think since we just have 1 minute, or we are even out of minute, but I think you have read the second one. So if you can just say what the question is and if you can answer it, because it's directed to you.
Yeah, the question is from Boss, who's been our AV colleague in the past, and he's asking about whether we have checked any vector-borne disease correlation with this one. So, Boss, sorry to say, it's very interesting. When I was reading your question, and I had never thought about this, but we tried to do, we didn't do anything on that part. We never thought about that actually, but we tried to do, measure some greenhouse gas emissions, which ultimately we couldn't achieve because of the facilities that were not prevailing in the laboratories in Bangladesh. But I think this is very interesting, as you rightly say, malaria in Bangladesh, although it's not very predominant, but then it becomes a very important. We have seen farmers actually drying their rice fields for some time, which they understand is a kind of their own AWD without using a pipe. But it was very difficult for us to actually go on everyday basis and measure the water levels and see if that was. We actually were focusing on the pumps and data coming from those tube wells, how much they have used, which again was challenging for us to do. So I'm sorry we could not, look at that aspect where, we could see if mosquito breeding or that vector breeding was affected by AWD.
Yeah, with that, I think we are already over time. I would like to thank a lot my panelists. I think that was a wonderful discussion. And hopefully, I think the audience would have got more insight on, how the evaluations work and the challenges that are associated, not only the technical challenges, but also the stakeholder engagement challenges and technological challenges, right? I mean, the testing, there's this evaluation design part, there is a stakeholder engagement part, and then Anna, I think, repeatedly has also talked about the technical challenges, just the measurement challenges of some of these indicators, which are extremely important, but also very challenging. So with that, I would, end this session. But again, thanks to everybody. Thanks to the wonderful audience. I think we got some great questions, and sorry, we did not have time to answer all of them. But of course, you are, welcome to get in contact, get in touch with Anna or Manzoor or 3IE, us. If you have any questions that you would want to be answered, please feel free to do that. Thanks again, and goodbye to everybody. Yeah.
Thank you, Anna.
Thank you.